So in the previous class, we have already discussed all of these things, but I'm now going to tell you again. Okay. So firstly, we know that in the leg there are three compartments: anterior compartments, lateral compartment, and the posterior compartment. And we know that the anterior compartment contains four muscles. In the anterior compartment of the leg, there will be four muscles. So from medial to lateral, how many muscles we can find? Four muscles. So firstly, we can find that is the tibialis anterior, and then you can find this muscle that inserted into this hallucis, and that's why this is called the extensor hallucis longus. And you can find another muscle here, this muscle here, that gives four tendons to insert it into these four fingers, and that's why that is called the extensor digitorum longus. And lastly, along with this digitorum longus, you can find another muscle that is called peroneus tarsius. Okay, so I am telling it again: from medial to lateral, four muscles. Firstly, tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tarsius. So these four muscles we can find in the anterior compartment of leg. Okay. And when you are going to discuss about this heart part, so there is a question normally asked. Which question? Just can you tell me the relation of the lower part of the tibia? Means in the lower part of the tibia, which are the muscles that are arranged? So you have to tell the relation. So you can give the answer in that way. In the lower part of the tibia, from the medial to lateral, we can find four muscle tendons: tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the peroneus tarsius. But in between these muscles, there are some artery and nerves that are present. So can you tell me, if there is a nerve present, which nerve that should be? Deep peroneal nerve. আমরা তো আলোচনা করেছিলাম গতদিন, আমি আবার একটু তাহলে বলি। Okay, we have discussed earlier that is the sciatic nerve, and sciatic nerve here is divided into two parts. That is called the tibial nerve, and we know that the tibial nerve that goes through this posterior aspect, and that is called the common peroneal nerve. And the common peroneal nerve that goes through here and here, the common peroneal nerve that goes through here, and in the neck of the fibula, the common peroneal nerve that divides into two parts. One is called superficial peroneal nerve, one is called deep peroneal nerve. Superficial peroneal nerve that goes in through this lateral aspect, and the deep peroneal nerve that goes through this anterior aspect. So that means if you find